I'm Dr. Jayaprakash Appajigol. I'm a consultant physician in KL's Dr. Prabhakar Kore Hospital, Belgavi. And also I am Associate Professor of Medicine in Jain Medical College, Belgavi. Today, I'm going to discuss about understanding hypertension. So what is hypertension? Generally, everybody has got some amount of blood pressure. So blood pressure is required to pump the blood to all the portions of the body. So it is called blood pressure. So it is the pressure what the flowing blood exerts on the walls of these arteries or blood vessels. We call it as a blood pressure. But only thing, when this blood pressure exceeds some limit, exceeds some numbers, then we call it as hypertension or high blood pressure. So there is no one reason to cause this hypertension. There is no one cause, like one bacteria comes and makes a disease. It is not like that. So we have multiple risk factors for this blood pressure. Risk factor in the sense there are multiple factors which makes somebody prone to get this high blood pressure. What are these? Getting older itself is a biggest and most common risk factor for high blood pressure. And somebody is having family member is a hypertensive. This makes you more prone for getting high blood pressure. Similar way, excess salt intake, low potassium intake, eating processed food, being obese, and getting stressful conditions, means a person working in a stressful condition or getting stress, all these things makes person prone for getting this blood pressure disease. So there are so many other causes also. There are some diseases which can cause this high blood pressure. For example, somebody suffering from kidney disease, somebody suffering from disease like excessive steroids, somebody is having disease related to kidney related arteries, and common disease like thyroid disease, diabetes. These people are also at a chance of getting more chances of getting blood pressure. So how the person of this blood pressure presents to a doctor, or what the symptoms this person gets is also equally important, isn't it? So all the blood pressure patients will not have symptoms. You may be thinking that person with blood pressure should have giddiness, blackouts, falls, headache, such things. All blood pressure patients will not get such symptoms. So symptoms will occur only at the later stage. Many a times the patient is unconscious, he had a hemorrhage in the brain or bleeding in the brain, what we call, that time his blood pressure may be detected first times. Otherwise, most of the blood pressure patients are non-symptomatic, means asymptomatic, means they don't have any of the symptoms or problem to go to the doctor only. Many times BP is detected when patient is just for routine checkup, BP is checked. So blood pressure we call it as silent killer, because if it is not treated early, detected and treated early, it may kill a person. So why we need to treat this blood pressure? As I told, blood pressure is known to cause some complications. Blood pressure is known to cause some complications. That's why we need to treat this blood pressure. What are those complications? It can affect brain. It can cause paralysis by causing stroke, or it may cause bleeding in the brain or thrombosis in the brain, which can cause stroke. That is the way. Then it can cause kidney failures. It can cause heart attack. It can cause problems in the eyes. So multiple organ systems or body systems it can affect and cause disease and cause the patient to suffer from so many disease and symptoms. So we need to prevent these complications, especially the paralysis and heart attacks and eye problems. We need to treat this blood pressure. So once we control this blood pressure, most of these complications can be well controlled. And how to diagnose this patient is having higher blood pressure is also equally important. We cannot tell like little bit of rise in BP is called as a disease of hypertension or a BP disease. So good thing is that we have a simple apparatus for diagnosing this blood pressure called as a sphygmomanometer. Now many times non-mercury apparatus are available to diagnose this blood pressure. So you need a good calibrated BP machine is one of the requirement for diagnosing high blood pressure. So normally, what is the blood pressure? Generally, we have read in school books also, normal blood pressure is systolic, that is the upper one what we write, numerator, that is 120 millimeter of mercury, and denominator is 80, or a lower one we call it as diastolic blood pressure, upper one we call it as systolic blood pressure, that is around 120. Diastolic blood pressure around 80 millimeter of mercury is the normal thing. So when like generally consideration is there are so many things like age dependent, disease dependent. Okay, blood pressure ranges are different, but general consensus is if somebody's blood pressure is systolic more than 140 and diastolic more than 90 millimeter of mercury, we label that person as having higher blood pressure. So this high blood pressure is dangerous. Treatment of this high blood pressure is important. We need to treat this so to prevent the complications, as I earlier told. So on 17th May, we celebrate to make the people aware of what are the consequences and what is the importance of getting tested this blood pressure and treated this blood pressure. On 17th May, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people who are living with blood pressure in the worldwide. So this year theme of blood pressure was measure your blood pressure and control it and live longer was the theme. So rightly said, measuring is most important. So we can detect somebody's high blood pressure, then getting treatment, and by getting treated, person can live longer. How to prevent this development of high blood pressure? We know we saw so many complications and all. So how to prevent this? So some of the things which we can do to prevent blood pressure is getting higher blood pressure is regular exercises, healthy diet, quitting smoking and alcohol intake, regular blood pressure monitoring and getting treated, stress management, and adherence to medications. Low salt diet is one of the important things to be stressed upon here, because decreasing salt intake itself has got very good effect in reducing blood pressure apart from exercise and good diet habits. So these are some of the things which can use to reduce the blood pressure. So at last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular complication. As I told, blood pressure can cause dangerous disease like paralysis and heart attacks. These are two important dangerous diseases associated with blood pressure, which can be easily prevented by just taking one tablet by consulting your doctor. With regular monitoring is also equally important. Apart from medications, low salt intake, good fruits, intake of fruits and vegetables, and regular exercises is also equally important to control the blood pressure. Thank you.